June is Men's Health Month, a time to raise awareness about health issues that often go undiscussed. And one of those issues is male infertility. Dr. Parviz Kavoussi is a reproductive urologist at St. David's South Austin Medical Center, here to talk about the causes, the treatments, and what men should know. Dr. Kavoussi, thanks for being here with us.
Thank you for having me.
First question here, let's talk about just how common male infertility is. This is something that is more common than most people think.
Absolutely. It's remarkably common and very underdiagnosed, unfortunately. So about 1 in 7 couples has trouble getting or staying pregnant. 20% of those couples, it is solely due to a male factor. Another 40% of the time, there could be a male factor plus a female factor. So that means when you do the math, 60% of the time, when there's a challenge, there's at least something going on our side. So very common.
Yeah, a lot of people do assume that this is mainly, infertility is mainly a women's issue.
Right.
That's why it's so important to get men involved in the conversation, correct?
Absolutely, and I think one of the challenges that we've had is, number one, because the male side gets ignored in a lot of places still in 2026, we're not getting the best opportunities for a lot of those couples, maybe to do simpler treatments or more effective outcomes when we look at both sides. And number two, what ends up happening is the burden and the onus ends up on the women, which honestly is not fair. We should have equal assessments and then understanding of where can we get gain to give that couple the best opportunity to build their family.
But sometimes it's difficult for men to talk about this.
Of course.
Yeah.
There is stigma that goes along with this, unfortunately, still. It's nothing, I mean, no guy expects to be sitting in my office having these conversations. But this is part of the conversation that we have. We talk about how common it is. It's nothing out of the ordinary. It's nothing that's reflective of anything else but that man, but a certain part of the machine and their cellular function. It's just another part of the machine. So our goal is, can we fix it? If not, then how can we help that couple get pregnant best with the cells that we have available?
What should men be watching for? What are the symptoms here?
So there are not a lot of symptoms that are going to show up for subfertility, for having low sperm counts or even no sperm sometimes. So I think the things to be aware of is what are things that cause it that are preventable, and then which ones do we need to at least be aware of to try to know when to seek help for. So, you know, there's a lot of causes that we find for male infertility, things like environmental factors, lifestyle factors. There's anatomic factors that won't be picked up unless a reproductive specialist is examining a man. There are genetic factors, there are hormonal factors. So there's a lot of things that play a role here. So I think when that couple sees that they're struggling, they're not getting pregnant, getting both sides evaluated is critical so that we don't miss half the equation.
You have to be aware of the factors here, and that's probably what treatment would look like based on the factors.
Absolutely. So depending on what the causes are, couples get to choose which route is the right and fit route for them as a couple, depending on, are they going to jump to levels of technology? Are there factors that we really need to address because of potentially things like sperm DNA health that regardless of technology can still impact outcomes? So, you know, first we talk lifestyle. We keep guys out of hot tubs, out of warm baths, out of saunas, no tobacco, no marijuana, minimize alcohol, no testosterone supplementation, either medically or supplements meant to boost testosterone. These can all have an adverse effect on fertility. Then it's important to have a good physical exam. You know, 40% of my infertile guys walk in with an anatomic variable called a varicocele, basically like varicose veins, that are bad for sperm health and numbers, that I fix with a minor surgery, and they go home and their numbers come up and their sperm health gets better. Hormone factors, we do hormonal analyses. Are there hormonal factors that are bad for fertility that we can simply treat with medications? And then in the more severe scenarios, we want a genetic evaluation to understand, are there other health risks for those men? What are potential outcome impacts for offspring? And what are the causes that are causing this? And those aren't always correctable, but there are usually ways to work around them.
Very quickly here, what would your message be to men who are hesitant to seek this kind of care or have this conversation?
The sooner you get evaluated when there's concern, the sooner we're going to get you on the road to building your family. And that you're not alone with this, it's very common, and that there's a lot of help out there now. Just seek help and we'll get you going in the right direction and we'll get your family built.
Starts with a conversation there.
Absolutely.
Dr. Kavoussi, good to see you here.
Thank you, pleasure to be here.